Sexually transmitted infections. Miriam Dadar and Sarah Gonzalez. Index. What are sexually transmitted diseases? What are the behaviors that cause this? What should we do to reduce our risk to get STD? Symptoms and treatments for STIs. HIV and AIDS. How HIV destroys the immune system. Symptoms of HIV. Treatments for HIV. What are sexually transmitted diseases? Sexually transmitted infections (STIs) are diseases that are passed on from one person to another through sexual contact, and sometimes by genital contact. Some sexually transmitted infections can spread through the use of unsterilized IV drug needles, from mother to baby during childbirth or breastfeeding, and blood transfusions. Examples of sexually transmitted infections include chlamydia, chancroid, crabs, public lice, HIV/AIDS. What are the behaviors that cause this? Many people engage in risk behaviors that can result in unintended health outcomes. Some of those behaviors are having many sexual partners, having sexual relation with a lot of people or people that you don't know, no use of protection, having sex without the use of contraceptives, use of alcohol and drugs, doing sex under the effect of alcohol and drugs, multiple sex partners, engaging in unprotected sex, in other words, sex without a condom, combining substance use with sexual activity, to forget to get tested frequently, no use of vaccines that can help you prevent those diseases. What should we do to reduce our risk of getting an STD? Communicate. Talk with your partner about STIs and prevention prior to sexual activity. Don't be afraid to talk with your healthcare provider about your sexual practices or to ask about STI tests. Get tested. Many STIs can be silent, causing no noticeable symptoms. Some STD/STIs may not be detectable through testing for anywhere from a few weeks to a few months, so talk to your healthcare provider about the right time to get tested. Limit the number of partners you have. Protect yourself. Condoms work really well in stopping most STIs from being passed from an infected partner to another when they're used consistently and correctly every time a person has sex. Learn about vaccines. One important prevention tool against STIs is vaccination. Currently, vaccines are available to protect against infection with HPV, hepatitis A and hepatitis B. Avoid alcohol and drug use. Avoiding alcohol and recreational drug use reduces the risk of contracting an STI, having an unwanted pregnancy, or being coerced to have sex. Symptoms and treatments for some STDs. You could have an STI and be asymptomatic, which doesn't have any signs or symptoms. However, you're still at risk of passing the infection along to your sex partners. Visit your doctor so you can identify a potential infection and get treated. Some of the following diseases, such as hepatitis, can be transmitted without sexual contact. Others, such as gonorrhea, can only be transmitted through sexual contact. Symptoms and treatments for some STDs. HIV and AIDS. AIDS, acquired immune deficiency syndrome or acquired immunodeficiency syndrome, is a disease caused by a virus called HIV, human immunodeficiency virus, which attacks the immune system, disarming the body's defenses against infections and making people much more vulnerable to infections and diseases. How HIV destroys the immune system? HIV attacks and kills crucial immune system cells, known as T helper cells. Without T helper cells, many other immune system cells cannot not work properly, including B cells that make antibodies. A person infected with HIV may not show any symptoms for years, but untreated, the number of T helper cells steadily drops. Eventually, the numbers fall so low that the risk of infection greatly increases, and the symptoms of AIDS appear. Symptoms of HIV. Treatments of HIV. Several drugs are now available to treat HIV infection. Some, including ASD, interfere with the virus as it tries to copy itself inside the immune system cells. Other drugs stop the virus maturing and leaving the cells. None of these drugs cures HIV infection or AIDS, although when used in combination they can delay the appearance of symptoms, perhaps indefinitely. However, not everyone in the world infected with HIV can afford or get access to these drugs. Bibliography. http://www.cmbrew.com/mix/std. Less than frame border equals single quote 0 single quote nores is equals nores is src equals single quote http://www.cmbrew.com/embed/std single quote name equals underscore subframe width equals single quote 920px single quote height equals single quote 600px single quote greater than less than slash frame greater than